All right, welcome back once again, and coming down to the end of the afternoon. Jerry Friedman is a terrific friend of UC Davis and a terrific friend to California and the California counties, and we admire and respect him so much and his knowledge about what's happening, and we're always glad to have him come out and visit with us and share what he sees in DC. So would you welcome Jerry Friedman?
Good afternoon. I notice on the schedule that we're a little bit ahead of time, so I've been asked to stretch it until 4 o'clock. I want to thank everybody for being here, for hanging in for the afternoon, and just tell you that it is great to be back. I always feel like it's such a privilege to be able to come to the UC Davis. I also will apologize in advance. I am a real low-tech person. Even though I've been responsible for probably spending $500 million in my career on building new computer systems, I don't do PowerPoints. I tried it once and I messed it up so badly I just thought I'll never ever subject anybody to that again. I really enjoy the university environment, particularly this university. It's like almost out of central casting. And I do appreciate so much the work that the University of California at Davis does. So special kudos for holding this training in even very, very difficult times. You know, we in the health and human services industry tend to do some really dumb things during tough times. One of the things that we do is we cut prevention programs. Well, we know that that's very penny-wise and pound-foolish and always comes back to haunt us. The second thing we do is that we tend to cut employee support services, things like conferences and subscriptions, travel and training, and God forbid, association memberships. At a time when we really need it the most, you know, when things are tough and we may be losing our coworkers because of downsizing or furloughs, when we're short-staffed, when we have the most limited resources and increased service demand, when we have the greatest need to upgrade our skills and morale is at its lowest, we decide to strip everything that could possibly make somebody feel better about being in this profession away from them. So I really want to commend the leadership in California for being ahead of the curve on this, for going ahead during difficult times to hold a seminar like this. I think it's really a testament to good thinking. And I have to tell you that unfortunately, getting around the country, it is also rare. So often training is being cut. So thanks for all of that. The first thing I want to do before I get into anything else is to really thank you for the work that you do each and every day to improve services for vulnerable children in this country, particularly in California. The work that you do to uphold the public trust, particularly as finance officers, the work that you do as policy folks and program folks to provide a safety net in this country, to protect our most precious resource, our children. You know, our children constitute about 25% of our population, but they are absolutely 100% of our future. And I truly believe that there can't be any higher calling than being in service to others, and particularly public service, that we are engaged in the most noble of all professions, and it's just a great honor to be in your presence today. The other thing that I wanted to do really was to thank you particularly for your support of APHSA, your national association. The California counties represent our largest membership base. I don't know what we would be without California counties, as well as the state, and we're very proud of the partnerships that we have, both with the state and the local leadership. To our members, I want to say thank you. And for those of you who are not members of APHSA, and there's very few in California, I want to say that it's not too late, folks. You can always sign up. For those of you who don't know, APHSA is a 79-year-old nonprofit, nonpartisan organization that was really founded around the same time as the Social Security Act by a group of very progressive thinkers who got together and said, we need to do something about the distribution of relief in this country, if you can remember what that was. For over 60 years, we were known as APWA, the American Public Welfare Association. Basically, we do three things. We work for good, effective public policy when it comes to health and human services programs. Now, we're a 501c3, so we don't lobby, But we educate, and sometimes actually we educate quite strenuously. We fight for good public policy, and what do I mean by that? Well, policy that's adequately funded. Don't send us on any fool's errands. We fight for state and local flexibility. Let's leave it to the folks who are entrusted with providing this service to have as much flexibility as they can to do it right. We fight for administrative simplicity. Don't choke us in unnecessary paperwork and redundant processes. And we also fight for public policy that's client-focused. So that if you can think in terms of being able to do the right thing, that's what we stand for. The second thing is really in the area of best practice. How do we do it right? We try to capture the best practice, the best thinking that's going on in the country, and through our training and consulting and conferences and magazines and website, we try to convey that. So if you can think of doing the right thing and doing it right, then we're getting somewhere. And then the third thing is really focusing in on our public image. I truly believe that the biggest challenge that we have in public human services today is our public image. We'll only be successful to the extent that the public, the general public, and the leaders within Congress have confidence in our ability to manage our programs efficiently and effectively. So we try to give the right message. We try to put a positive spin on the work that we do and to tell a positive story. We have three major membership types. States, I'm very pleased that every state has been a member of APHSA for about the last 5 years. That also includes territories. We have about 200 local counties and cities, many of them, again, coming from California. We also have several thousand individual members, so that we like to think that within our tent, we have the state policymakers, the local implementers, and the individual practitioners, and that gives us a very unique perspective, kind of a way to blend theory and operations when it comes to the work that we do. Finally, for those of you who don't know, APHSA is structured a little bit like a state or a local umbrella organization. We have our state CEOs, secretaries, directors, and commissioners that comprise our national council, and we also have a local council that's headed by a Californian, Elliot Robinson from Monterey County. But in addition to that, we have 10 other associations that are part of our corporate umbrella. Groups like NAPQA, the Public Child Welfare Administrators, the Medicaid directors, the public attorneys, child care, and so on, so that we kind of have the categorical areas that are also covered, the areas of specialization. So that's who we are, that's what we do. That's the end of my infomercial. If you have desire for additional information, we have a great website. It's just www.aphsa.org. There's one other thing, though, that I think is important, because I had my roots in county government. I spent a good portion of my career as a caseworker, as a supervisor, as a human services director in 2 counties. And the conventional thinking at that time, at least for me and many of my colleagues, was that what happens at the national level is important, but what's really important is what happened in the State House. And by the time it all filtered down to me at the local level, several years had passed. Well, I discovered our association, and I began to get a different perspective, realizing that what happens at the national level does impact me in the community that I work in, and that I can have a strategic edge by staying attuned to what's happening from a public policy and a finance perspective. And so I tried to do that. Every year when the president would release his budget, when I was a county human services director, I used to hold a press conference the very next day. I'd call in all the media, and we'd have some of our county council there, our county executive, and I'd lay out all of the things that were in the president's budget, this huge budget. They thought I was a genius. All I was doing really was taking APWA's memo and paraphrasing it. So there's some advantages from that perspective as well. Now we're going to reach the most difficult part of the presentation for me and the most painful for you. I am going to try to tell a joke. Now, for those of you who were here last year, you know that I told everybody that I never miss an opportunity to tell at least one bad joke during a presentation, and so this is the moment. Now, here's the deal. I came all the way from Washington, D.C. by way of Austin, Texas. This was a long journey for me. So I'm going to tell the joke, and you're going to be very polite, and appropriately at the punchline, you're going to laugh out loud. if you can figure out where that punchline is. So here's the story. It's a story about a very, very competent, effective nuclear scientist who wins a Nobel Prize. And because of his accomplishment, he was hired by a Fortune 500 company and given all of the benefits and accoutrements that you could imagine. A huge salary, wonderful benefits, unlimited travel, and a chauffeur-driven limousine to take him around to all the various speaking engagements, which was his primary job. And the scientist noticed that after a while that his chauffeur kind of treated him with a little bit of disdain, just bordering on disrespect. And after a while he said, I just can't stand this anymore. I have to confront him. So he asked him, they were driving to their next event, and he said, I have to ask you something. If I've done something to offend you, why do you treat me with this level of contempt? And the chauffeur said, well, it's not personal. It's just our different status in life. Here you are, a Nobel Prize winner. You make $1 million a year. I'm in a demeaning position of driving you around, and I know that I'm every bit as smart as you. And I know that I've heard your presentation so many times, I could do it even better than you. So the chauffeur was thinking, or the scientist was thinking, he said, if that chauffeur really thinks it's so easy, I'm going to let him try to do my job. So they made this arrangement that when they got to the next city, the scientist would disguise himself as a chauffeur, take a chauffeur's cap and go to the back of the room. And the chauffeur, disguised as a scientist, would go up and give the presentation. And of course, they agreed to exchange salaries for a day. Well, what happened was the chauffeur got up in front of the podium and gave absolutely a stunning, perfect presentation. Every bit as good as the Nobel Prize-winning nuclear scientist. But then it came time for questions and answers. So the first thing that happened was a young engineer stood up and he asked a question, highly technical question. The chauffeur began to sweat a little bit and get a little itchy. And he finally said, listen, I'm a Nobel Prize-winning scientist. I've traveled around the world. I've met with engineers and scientists in every part of the earth. He said, and I have to tell you, in all of the places that I have ever been, that was the dumbest question that anybody has ever asked me. I am absolutely insulted by the level of that question. And to just tell you how little I think of it, I'm going to have my chauffeur at the back of the room answer it. You laughed. Thank you. See, maybe there's a stretch, but I think there's a little bit of a moral there about public service, because just about everybody I know thinks that they can do your job and thinks that it's easy. They have never walked in your shoes. They never know what it's like to be called in front of a congressional hearing or a legislative hearing. They don't know what it's like to construct a budget. They don't know what it's like to think about the kids who desperately need our services and how we stretch those resources. It is not an easy job, but there's that perception because we work for government. The private sector can always do it better and cheaper. Well, some companies, major companies, and some state politicians have learned a painful lesson about trying to oversimplify the work that we do. The end result, though, I think, really is that it's had a negative impact on us. Being in public service sometimes can lead to a degree of pessimism or even skepticism. And I think it's unfortunate, but I think it really is understandable. Let's think about this. We work in human tragedy each and every day. Each and every day, that's what we do. And our goals are so very high. We're really talking about building a better and a stronger society. I mean, if we do our job perfectly and everything lines up and there was no child abuse, we could be out of work, and that would be just fine. We are one of the few industries that are literally working to put ourselves out of business. The second thing is that, the challenges that we face are just sometimes overwhelming. Tonight, folks, 500,000 children in this country will not be sleeping in their own beds. 500,000 children. Every 35 seconds in this country, a child is abused, seriously abused. 30% of all Americans don't have health care. 25%, and probably growing, have food and housing insecurity. And 25 million Americans rely on food banks for their basic nutrition. We have always lacked resources. I have fought this my entire career, but when it came to doling out the money, for some reason, Health and Human Services always kind of seems to be at the back of the line or near the back of the line. I heard a statistic this morning. Children aged 0 to 3 are 4.2% of the population, 12.5 million children. However, only 2.1% of the federal budget is invested in them. To me, that seems like counterintuitive, that it should be the other way around. That you're spending twice as much on children and their development, but we spend half as much. We know how difficult the job is. When I was a Human Services Director in the county, I had 180 different funding streams to try to wade through. I mean, talk about that puzzle. And I don't need to tell you, I'm preaching to the choir because you do it each and every day. When I was in Texas, I was responsible for building a new computer system. We had to do first an inventory of the rules. These were eligibility rules. Guess what? We had 35,000 individual eligibility rules in Texas. The computer company said, unless you get down to 20,000, we can't even automate it. It just grew out of time. The job is very, very complex. Our failures are very visible. In my office in Washington, D.C., I cannot walk down the block before I confront the failures of our society. People who have been left out and left behind, who are not enjoying the bounties of this rich country, the homeless population, those that are mentally ill, those that have no resources. We conduct our business in the open. If we make a mistake, you're going to read about it in the front page of the newspaper. Corporate America, until very recently, didn't have to deal with that. So I think it's kind of interesting. And the other thing, and particularly in child welfare, folks, is that we have zero tolerance for error. You know, we have no children that we can lose. I don't think that the media realizes that it is just or more painful for us when we lose a child than it is for them. And, you know, I think it's really impacted us. We did a study at APHSA. More than 1/2 of the public child welfare administrators in this country have less than 2 years' experience. How do we make change under those kind of circumstances? So even during the best of times, that's the reality of doing our job in the health and human services arena. But now we are faced with perhaps the biggest financial crisis of our lifetimes. You know, it's an unprecedented challenge on top of everything else. And as you know, health and human services is countercyclical. At a time when our resources are most stretched, the demand for services is at its highest. Right now, 32 million American families are reliant upon food stamps. Well, it's now SNAP. I have real trouble with that acronym. But think about that. It was 18 million about 2 years ago. 32 million American families. Almost every state has had huge budget deficits. And of course, California always seems to be leading the country in everything, including some of those. For the past 2 quarters, there has been a 4% decline in resources, or in revenues. States and local governments really face a unique situation. States are not allowed to run deficits. They have to have balanced budgets. There are no rainy day funds. They've all been depleted. The tax base is really established under a manufacturer's, 1950 manufacturer's climate. It doesn't take account the service and the information exchange world that we live in today. So consequently, the tax base is based on property taxes, income taxes, and sales taxes, and they're all declining. You know, we've just about tapped out all of the other tricks that we had, selling off our assets. You know, I mean, some states are even trying to sell highways to turn them into turnpikes, selling off things like state parks. We've done so much with sin taxes, you know, particularly tobacco. I don't know how much more we can rely on that. I keep thinking there's going to be one smoker left in this country, and it better be Bill Gates, because we're probably going to charge $1 million a pack. User fees. I went to a state park, $25 a carload. I mean, how much further can we go? And you couple that with all of the serious staff cuts and the furloughs that we've had and the reduced services. And when you add in things like the inflationary increases in health care, twice the rate of inflation on average, the depleted pension funds, we're facing this at APHSA. The demographics of an aging society, more and more people who are leaving the workforce, living longer, that's the blessing. Poor investment returns. I have a stack of envelopes I won't open. You know, they're from my various 401ks and things like that through the years. I just can't open them. I don't have the heart to do it. The credit crunch, corporate bailouts, the federal deficit, et cetera, et cetera, et cetera, and you get the picture. It's very easy to get depressed and actually frightened about what's going on. And it really does create kind of a compelling case for change. Now today, given that background, I was asked to talk about the national perspective, the view from Washington, D.C., a place that we define as 78 square miles surrounded by reality, with you folks being that reality. You know, and on some level, I'm very, very pleased to report that things are much different from the time that I had a chance to speak to you last year. At that time, I whined about the lack of leadership on children's issues, particularly within the Children's Bureau, the incessant micromanagement that was coming from Washington, D.C., the overly bureaucratic processes, particularly with the CFSRs, the breakdown in communications that we had in federal and state relations, complained about the Children's Bureau walking away from critical issues like the Interstate Compact and the need to develop a new SACWIS system, griped about the increased oversight, the audits, you know, the tone of distrust, not partnership that existed, the penalties. And all in all, it was a pretty negative picture. In fact, I depressed myself. We call that admiring the problem in Washington, D.C. But, you know, today I'm really pleased to offer, I think, a much more optimistic picture in spite of all of the challenges that we're facing. And it's not a rosy picture, but I think in some ways it is certainly more positive. There's a much different climate that exists right now in Washington, D.C. It's a little bit hard to measure, it's a little bit hard to articulate, but you can sense it and you can feel it. Certainly, we have aggressive leadership. Now, you may or may not agree, but President Obama has clearly hit the ground running. I think historians will look back on this like they did, you know, during Franklin Delano Roosevelt's attacking the Great Depression. There certainly is a much greater tone of collaboration and a degree of transparency that has never existed in my lifetime. The second thing that gives me some optimism, and this is kind of parochial, is that I believe that APHSA, our national association, and your work has put us in a much better place to be prepared for the changes that we're facing. 2 years ago, our national council and our local council really concluded that we needed to focus in on the future. You know, that regardless of who was going to become the next president, what the Constitution of Congress is going to look like, we really needed to focus in on the future because there was very little that we were going to be able to do to impact the last 2 years of an administration that was leaving. We could do damage control better, perhaps, but we really needed to invest in where we wanted to go. So the nation's health and human services leaders got together, and they did this over a 2-year period, and they gave up a lot. They had 2 CEO retreats where the nation's leaders got together over a weekend. They gave up a weekend, 2 of them, to just bang out issues related to health and human services, to try to obtain consensus. We met every afternoon at our APHSA conferences, quarterly policy council meetings, numerous conference calls, affiliate work, local council work, and it led, I think, to some really significant products, 4 of them to be exact. The first was a letter to the candidates. We wanted to let them know who we were. Well, who are we? We are 1/3 to 1/2 of most state and local budgets in this country. We touch at least 1 in 5 people, and in some communities, as many as 1 in 3. We are among the largest employers of most communities, and we needed to be taken seriously as a human services industry. It is time that we said that. It is time that we got political. The second thing was a white paper that was called For Those We Serve. It was really kind of a high-level statement of principles, how we viewed the world, the compelling issues, what we really cared about. The third was a document that I'm most proud of called Focal Point, and you can get this all on our website if you haven't seen it. It was our transition plan. And we have done transition plans before at APHSA. You may have remembered documents called Crossroads. There was Crossroads 1 and there was Crossroads 2. What was different about that effort is that they were pretty much staff developed and member endorsed. The thing about Focal Point that made it different was that it was really member developed and staff supported through all of those efforts that they had done over a 2-year period. It meant a level of investment by the nation's health and human services leaders in our transition plan that we didn't have before. There were 4 major themes, or 4 major clusters of activities. The first, and this was really kind of surprising, I don't think this would have happened 8 years ago, but the nation's leaders decided that the breakdown in federal and state relations was the most compelling issue that we needed to address, that all of the other programmatic concerns were going to fall short unless we got to that very basic issue. We had to acknowledge that the relationship that we had with the federal government wasn't really satisfactory to either partners, and somehow we had to work to find that balance of flexibility as well as accountability. The second area was in economic services, supporting individuals, families, and communities. And what it really called for was kind of a new vision of well-being that comported to the national norms in a sense of human dignity. Yes, indeed, we are our brother's keeper, but people have a personal responsibility to improve their human condition. The third was in healthcare. Now, we didn't embrace any specific healthcare platform. Trust me, there are hundreds of them. You know, you can pick any one that you want, and probably none of them are going to be precisely adopted. What we did was try to look at the principles. What did we care about? One overriding principle was that something that isn't said too often is that we really are our own primary caretakers responsible for our choices. So much of the healthcare costs go to things that are preventable, they're human behavior related, things like smoking and drug and alcohol abuse, obesity, things like that that we can control. We also knew that we needed to rely on a healthcare profession that was patient-centered, competency-based, and performance-focused, and that public policy should reflect that, and that it needed to be accessible, affordable, and available. And then finally, in the area of child well-being, the area that you care most about. And this is what our nation's leaders said, that there was a shared community and government responsibility. The government can look at safety, they can look at permanency, but it was a shared responsibility to look at child well-being. The children were entitled to live in safe and permanent homes, that working parents needed affordable child care, that public policy must support and not supplant the work of families. That's not subtle, folks. That's right out there. That public policy had to focus in on prevention, that we could not lose sight of the need to do that, that we needed to reform the CFSR process, and that federal financial reform needed whatever form it took to eliminate the look-back, one of the most ridiculous bureaucratic provisions I have ever seen in my 40-year career. We had an interesting occurrence at APHSA. After we drafted Focal Point, we all got together for a policy summit in December in Nashville. And I have to tell you that the California counties were very well represented. I mean, they truly were, through the California County Welfare Directors Association, through the leadership, but also through county human services directors. As I mentioned earlier, Elliot Robinson's on our board. He's also on our National Policy Council, so they really weighed in. And what our members saw after the election was this sense of opportunity and even a sense of urgency that we needed to act more quickly than just the traditional kind of transitioning that we would do. And so we developed a 30-day strategy. What we could do without a lot of legislation, what we could recommend to the new administration to make changes in health and human services programs. I was really proud of the work of our members. They adopted Focal Point. That was the easy part. It wasn't the hard part. Coming up with a 30-day strategy was a little bit more difficult. And I have to tell you that we're very pleased with the outcome of that. Many of the things that were included in that 30-day plan have become reality. The first priority was enacting reauthorization for S-CHIP. All of our members felt that it was appalling that Congress hadn't acted on S-CHIP, healthcare for children. And as a result, 10 million more children in this country are eligible for health benefits. The moratorium on some very critical regulations promulgated by CMS, Medicaid regulations. We wanted a moratorium on that. We wanted to continue the moratorium because it was going to expire. Well, that happened, and yesterday I am very pleased to learn that most or of all of those regulations have gone away. Regulations that would govern school-based services, rehab, outpatient services, and even targeted case management. There are some provisions in it, but the most egregious regulations around targeted case management, for those of you who follow it, have gone away. And that is huge, folks. That is huge for all of us who care about children in this country. The stimulus also, we wanted to make sure that Health and Human Services was part of the stimulus package. At that point, it was just the early part of the thinking about what was going to happen. My experience is that we're not really main drivers in that, but you know what? It changed. We asked for an increase in FMAP, the matching rate for Medicaid. Well, $15 billion was set aside for that purpose. We asked for an increase in food stamp allocation, $19.7 billion in nutrition benefits. We asked for an FMAP increase for 4E, and I never thought in my wildest imagination that it would be adopted, and it was. A 6.2% increase in the federal matching rate for Title 4E. What an accomplishment. And also $187 million for adoption assistance. Those were good indicators. So in terms of the transition, you know, we're pleased. But I'm also even more delighted with the level of communication and cooperation that we have received. We have met with the transition teams on numerous occasions around numerous issues. They've consulted with us on appointments, who we think would make good leaders in the new administration. That was unheard of before. They published Focal Point on the Obama transition website. You know, we thought that was really kind of neat. And they're walking the talk. Secretary Vilsack from USDA spoke at our most recent APHSA conference 2 weeks ago. It's rare for us to get a department secretary to come. He reached out to us. And so, you know, I think, you know, that we're really in the right track. We were disappointed that the Health and Human Services Secretary nominee, Senator Daschle, dropped back, mainly because it was a setback in terms of time. But we're also very pleased with Governor Sebelius. While she was governor in Kansas, she asked for several drafts of Focal Point from her commissioner, Don Jordan. So we saw that as kind of a positive clue. There's clearly a more open, a more responsive, and a more collaborative tone that's being set. But of course, that's always within the context of no money or less money. You know, my parents used to kind of wax nostalgic for the Great Depression. And I could never figure out why, because everything I read in the history books was that it was just gruesome. Now, remember that they were newlyweds, and the way that they used to describe it was, well, we were broke but happy. That's how I'm thinking that we can describe, at least from our association standpoint. We're broke, but we're happy because we do have open channels that didn't exist before. So let me talk a little bit about some of the specifics, some of the things that we see unfolding in Washington, D.C., which was supposed to be the topic of this presentation. The policy discussions have really hovered around three major areas. First is ARRA, something that you can add to your new list of bad acronyms, right along with ABODS and HISATAG and a few other things. The American Recovery and Reinvestment Act. You know, the question is, how will it be spent? Will it be spent right? And what follows? What's after ARRA, you know, the stimulus package? The second is the fiscal year 2010 budget. The budget resolution has been completed, and I understand that today the Obama administration is supposed to release the details. That will really start the process in earnest. And I just want to point this out to you that probably on Thursday, check your inbox, check your emails. We will be holding an all-state and a local conference call to describe the information as we see it coming from the President's proposed budget. Very, very important. Then you can hold a press conference, like I used to. Healthcare. This obviously is one of the administration's top priorities. And many really believe, and I think that I agree with this, that if it needs to happen quickly, while the President still has a great deal of political capital in order to make healthcare reform a reality in this country. So that the next few months, I think, are going to be very, very critical. You know, the longer the delay, the less the likelihood of chances, at least of having real health care reform in this country. So let me talk about these just in a little bit more detail. The ARA, the American Recovery and Investment Act, as you know, it set aside $700 billion, God, it's easy to do that, in federal assistance for a wide variety of state programs. In addition to the FMAP increases that I mentioned in Medicaid and nutrition and 4E, there was $1 billion for restoration of the federal match for child support incentive programs. There was $5 billion in TANF emergency funds. These were to accommodate caseload increases because of unemployment. There was an additional $1 billion for the Community Services Block Grant, kind of flexible money. When I was in your shoes, I used to love to get this kind of money because it had more flexibility to it. And $2 billion in the Child Care Development Fund, which also we think is really important as people are striving to find work. There's also money for the Workforce Investment Act and VOC Rehab and a wide array of other programs, and I won't get into the detail. The good news for states, particularly those in dire circumstances, which is almost everybody, is that it will provide some relief. You know, but the question is, will these monies be spent in a stimulative way? Now, it's real easy when you're talking about food stamps to make a case that we're stimulating the economy. You know, if somebody gets an increase in their food stamp allocation, they can buy more groceries. That means the grocer can buy more from retailers, who can buy more from growers, who have truckers that have to haul this stuff. You can see that there's kind of a cascading effect. It's a little bit more difficult in the child welfare arena to say that the money's being spent in a stimulative way. So there's some question about that, but in either case, the one thing we know is that with this money there will be strings. There will be greater accountability and transparency. You know, it is a double-edged sword. The stimulus, all the information is being posted on the internet. Anybody can have access to it. So given the tension that they had around TARP, you know, which was the bank bailout stuff, and the concern over misspending, like the corporate bonuses, states are now getting really mixed messages from Washington, D.C. about this money. You know, spend the money quickly because there's great need out there, but don't spend the money on anything that's not stimulative. You know, do it fast, do it cheap, and do it good, and don't make any mistakes. You know, the stakes are really high with all three of those things. And included in this, people don't talk about too much, is $359 million that goes to the OIG and the General Accountability Office to take a look, to support the Oversight Board to make sure that we're doing this all right. The Office of Personnel right now, the federal office, is in a fast track to hire thousands of auditors and overseers to make sure that that happens. So for the states, I think the issues are around three areas. Number one, there's a very, very short window of opportunity, a time to obligate and to spend this. In addition to that, there's quarterly reporting. So you folks who are getting stimulus money, and maybe you're already starting to get some instructions around it, are going to have to work in a very, very hurried way in order to do this right. It's going to require separate tracking and reporting, as if you didn't have enough to do back home. And we're going to have to try to report on the number of jobs that were created and or protected. That's going to be a lot of fun, particularly for program evaluators. And I think one of the more critical things is that we need to balance the immediate needs that we have to fill holes in our budget with kind of the longer range, short thinking about what's going to happen with the ARA funds when they go away in 2 years. These funds will not continue. This is a one-time deal. So the trick is to try to spend it in a way that isn't going to set us up for a huge problem 2 years from now. And in many ways, we're still waiting for guidance from the federal government and probably won't get that until the summer. So for many folks, it's more complicated than we thought. And the other dynamic is that the opponents of the stimulus package, the ARRA, they're really combing for all kind of inappropriate expenditures. I can just see the headlines now for the next 2 years. They spent money doing what? So we need to be attuned to that. In terms of health care, there's tremendous attention that's going on, and nobody has a crystal ball. But I think that there are several things that we can count on with health care reform. Number one, technology is going to be very much a part of it. There already is funding for health information technology. It is absolutely necessary to run a modern healthcare system, to have a modern computer system to support it. There will be focus, of course, I think, on disease management. They found that to be an effective technique, not only in terms of service, but also from a fiduciary perspective. There will be increased emphasis on prevention and wellness programs, and I say that's about time. We'll have some form of utilization review. Now, the critics of this call it rationing, health rationing, but I urge you, if you really have an interest in this, read Senator Daschle's book and to see how that's what he describes, because I think very much that's what Congress is taking a look at. There will be a combination of both government and private health insurers that will kind of make up the health care reform, and probably Medicaid will play a major role in terms of expansion for low-income folks who are not currently eligible. I think that that'll change, and they're going to take advantage of that relatively efficient network. People don't like to think of it, but when you look at insurance providers, Medicaid is perhaps the most efficient that we have in this country. I would urge you all, even though you're thinking about children, to really pay attention to the debates that are happening with health care, because it is going to affect every program in government. The financing of it, how it affects our clients. We really need to be a part of this debate, regardless of our role. So let me talk a little bit about child welfare. After seemingly years of setbacks in child welfare, losses at the federal level, we're beginning to see some light at the end of the tunnel. We've had the successes of the FMAP increase in 4E. The Fostering Connections to Success also included 4E entitlements to include relative caretakers, something that we really welcomed. And while we perceive this all as good news, we know that many states, and this was mentioned earlier, are really struggling with some of the rules and because of the economy in order to implement it. I just wanted a little follow-up to the conversation this morning that let you know that APHSA, the National Governors Association, the National Association of Counties, and NCSL, the Conference of State Legislatures, has sent a letter to ACF opposing their interpretation that the Guardian Assistance Program cases can't be retroactive, that they had to be prospective. Now, I don't know what the results are going to be, but I can tell you that when 4 national associations line up like that very aggressively, I'm a little bit more optimistic than if we hadn't done it. Also, something you need to pay attention to, the Congressional Budget Resolution includes deficit-neutral reserve funds for child welfare, foster care financing, and expanding home visitation. We're also very encouraged by some conversations that we've had at the staff level on the CFSR process, the changes that we're proposing that ACF needs to take a look at. There's an old line that one of my former coworkers used to say about this, was that we are just too pooped to pip, that we need to have these changes. See, all of these signs think to what I think is kind of a transformation that's happening in child welfare. Leaders at all levels, within the industry, private, faith-based, public agencies, they're asserting themselves. They're getting together as partners. They're signing on saying that this is the one opportunity that we've had in a long time to make a difference. So we have this coalition being formed of community resources and education and other public entities kind of working towards this. We've learned, as Fred Wolshin said this morning, that we can't work in silos and meet the complex needs of children and families in this country. At APHSA, we're working with the nation's child welfare leaders on a project funded through Casey Family called Positioning Public Child Welfare. It's a little hard. I couldn't explain it to my mother. You have to kind of be in the industry to understand it. But what it is basically is a concerted effort to create standards for the administration of child welfare programs to literally define the field. We don't have a system of child welfare in this country. We've got 3,600 systems of child welfare in this country. So defining the components of what constitutes a highly effective, high-performing public child welfare program that truly focuses on outcomes for kids, finding those components, articulating that, and making standards from them is very much a part of this project. Because in the absence of standards, people make them up for us. The media does it each and every day. Politicians do it. They do it every day. So other professions like nursing and accounting and education have developed standards. Otherwise, it will be defined for us. Throughout the country, as Fred mentioned earlier, child welfare administrators are seeking waivers, like welfare reform 12, 15 years ago. They're looking at creative ways to have better solutions. They're going to the federal government or to the state government and saying, we have a better solution in our community. We think that we can do this better. Let's invest in the front end to preserve families and prevent more expensive foster care in the long run. It's better for taxpayers and it's better for kids. That's a momentum that we see building from the seat that we have at APHSA. And in that regard, APHSA has teamed up with 8 other associations to develop a statement on child welfare financing reform. We know how important and how critical that is. Also, I think that we have gotten better on relying on data. Fred Wolshin talked a lot about this morning. Many states and jurisdictions are developing their own data systems. They're turning away from SACWIS, saying this may be a good reporting tool, but it doesn't help me manage anything, and they're developing their own. We have 20 states now in the foster care data center that's operated through Chapin Hall and that we're partners on, looking at longitudinal information that we didn't have several years ago. So recognizing, that federal point-in-time compliance doesn't really lead to better outcome measures for kids. So states are more aggressively challenging CFSRs. They're challenging penalties, and I know that California is really kind of in the forefront of that, unfortunately. With all this congressional attention that's going on too, something that didn't happen before, Ways and Means committees in Washington, D.C. holding hearings on child welfare. We went for a long time, it was like a drought of discussion and dialogue and conversation about well-being of children in this country. We see this kind of new energy emerging. It's an attentiveness and an enthusiasm that's building, and perhaps, just perhaps, if we're good enough at our advocacy, it can turn into a movement. So the critical question is, how do we continue with this momentum and avoid all of the policy and political pitfalls that has consumed so many other progressive efforts in public administration? For me, most notably, welfare reform. How did we lose the flexibility that states had to develop that program? And the best antidote that I know is public policy, that's not based on ideology, incomplete data, whim, innuendo, politics, but public policy that's based on solid evidence, evidence-based practice models defined by objective, evaluative criteria. And that's what we continue to need to focus in on. And that's why it's so important that you folks continue to get together in forums like this, sponsored through the University of California at Davis, to look at the state of the art and how we can finance programs, how we can account for programs, and how we can plan for better programs. Our role at APHSA is to listen to you, to hear what you're experiencing and be able to articulate that to the public policy makers in Washington, D.C. And we are committed to that process. So I'm going to close with something. I guess I'm a little early. Is that okay, Larry, to close a little early? I can stretch it if you want, but it would involve 10 more bad jokes, and you just don't want to ruin this for everybody. I'm going to close with something. I actually did this last year, but I've changed it. I love to do this. I love to make lists, particularly top 10 lists. I'm a huge fan of David Letterman. I watch him almost every night because I'm well, for you folks, it's not insomnia, but on the East Coast, he comes on late at night. So I have I'm always watching him. I just love his top 10 list. So I try to develop my own top 10 list of steps that we can take as a profession to provide better services, to invest more in prevention, to achieve better outcomes, particularly for children, and to improve our public image. So, direct from the home office in Canyon Creek, Texas, my hometown, wish I had a drum roll, number 10. To improve the coordination and integration of services, to break down those silos. We still suffer in this country from a malady that we like to call hardening of the categories. I think we've made some steps in a positive direction through welfare reform and others, but it's real important, particularly for children, for us to recognize that children just don't come to our attention because of one thing that's dysfunctional in a family. You know, they have multiple needs, and we're short-sighted if we don't address that. The current categorical system just simply cannot address the multiple problems that families face. So we need to develop strategies that are more client-centric rather than program or problem-centric. Number 9, to continue to grow community partnerships and volunteers. You know, it really engages the community and it also adds to our capacity. But there's one other thing that happens when somebody volunteers, when you invite them in, is that they become advocates for your work, and they become advocates for the clients that we serve, particularly children. Very important, strategic, as well as good business. Number 8, to embrace information technology. Let's start maximizing some of the powerful automation tools that we have available so that we can ease the workload and get better data to make better arguments for why we need to serve children differently. This has been a major disappointment for me. You know, the problems that we have when it comes to information technology aren't technical. They used to be, but they're not now. They're political. Somehow we have to start grappling with the fact that we don't have an information system in this country that allows us to share data that we need to make good program decisions. We need to start looking at this differently. Many states are left with 20, 25-year-old legacy systems that are just unmanageable. They can't even pull maintenance on them anymore. And yet we haven't made that step to invest, you know, in modern technology that can address some of these. Number 7, to encourage wellness and prevention. What can I say? My father used to say it best. He'd say, you know, you save 100% of what you don't have to spend. And that's very, very true. Number 6, very important, particularly, I think, with all of the clues that we're getting from the Obama administration. Let's manage our resources prudently. We hold a very significant public trust. As I mentioned earlier, 1/3 to 1/2 of most state and local budgets are in health and human services. So we operate a compassionate business, but it's a business nonetheless, and we need to be prudent. Number 5, to adopt consumerism and client choice. Nothing about me without me. You know, people need to be personally invested. Families need to be personally invested in the solutions, in the case plans, and the development for that. And I think generally, at least from what I've seen, is that we've made huge progress in this area. You know, I started my job as a parole officer when, you know, we just made all the decisions about what somebody's life was going to be. You know, we didn't engage families. We didn't try to find out really where interests were, and I think that we've made huge steps. Number 4, to embrace quality control and program integrity. We are only as strong as our weakest link. Fraud, waste, and abuse really drags us all down. But I think that there's an obligation that's beyond that. For those of you who have an interest, you can check on our website and go to my blog. I'm almost obsessed, borderline obsessed, about a situation that's happened in Luzerne County, Pennsylvania, a place that I did a lot of kind of volunteer work years ago after a devastating flood kind of wiped out the community. 2 very evil judges accepted kickbacks for placing kids into private detention centers. The first thing they did was to close that detention center that was public and that was licensed, and then to contract with these private profiteering detention center operators who gave them a bounty for every child that they put in. I urge you to go to the Juvenile Law Center, jlc.org website, and read the court cases. More appalling to me, okay, there are evil people in this world. There are people who will do evil things. But for 7.5 years, the entire system turned their backs on these children. There were thousands of them that were sent away for first offenses. Thousands of them for doing things like writing Facebook parodies on school principals that they arrested for terroristic threats, for first offense shoplifters, for trespassers into empty buildings. It is so appalling that this happened. And a district attorney and a public defender and the media and the police and the county commissioners all stood by silently while these children, most of them without lawyers, were herded out of court in shackles and handcuffs and hauled off to detention. Worse than that, the Pennsylvania Supreme Court, I don't know why I shouldn't have started this, the Pennsylvania Supreme Court sat for 9 months on a petition filed by the Juvenile Law Center, an advocacy law group out of Philadelphia, without taking any action, only until they were, the petition was refiled and they had a one-sentence answer: your petition is hereby denied. Now, I don't know whether it made any difference, but the profiteering owner of that detention center was the son of a Pennsylvania Supreme Court justice. This is the kind of stuff, folks, that we need to be able to stand up. And I know it's an anomaly, and I know it doesn't happen. I started my career in 1970 as a probation officer in a juvenile justice system that I didn't feel particularly good about, and I'm going to tell you that I don't believe that that could have happened in my court system. So as long as these kind of things happen, we need to find the means to address it, and I am sorry for my rant, but I'm very passionate about this case. Sorry about that. Number 3, adopt a return on investment strategy. I think that this is really important. We need to state a business case of why it makes sense to invest in children and families before we put them in foster care. What's the cost of not providing health and human services? All of you are facing budget cuts. You know you have to cut corners. We all know that there's a long-range impact of that, you know. And the fact is that tugging on heartstrings today to people who make budget decisions doesn't quite get us to where we need to be. So we need to approach the notion that human services is an investment in a stronger society, that human services in the long run, if we invest in them, will save the community's money. Number 2, and I think that this is also very important, we need to invest in our workforce. You know, I'm really troubled by the high turnover that we see. I'm not sure that we treat our employees very well. I don't think we pay them enough. I think they're underpaid and underappreciated. You know, I think we need to get back to the climate, the privilege that I had as a young man graduating from college, where we used to talk about public service as being an honorable thing, attracting the best and the brightest. We have to get back to that. People should be proud of working in government today. And number 1, and this is always number 1, is that we have to maintain a client focus. We can never forget why we are in this child caring business to begin with. Because behind all of the rules and the regulations and the stacks of paper and the computer programs and everything else that we have to deal with is a real child who may be in pain and a real family who needs our services. And so that's my list, folks, and I'm going to stick to that. And I really think that if we continue to embrace it, even during this difficult financial time, with passion and with commitment and a sense of stewardship and teamwork, that we can really make some great strides in doing what we set out to do initially when we got into this business. Dr. Martin Luther King, shortly before his tragic assassination, said the following at a sermon at Ebenezer Baptist Church. He said, "Everybody can be great because everybody can serve. You don't need a PhD to serve. You don't need to make your subject and your verb agree to serve. You don't need to know Einstein's theory of relativity to serve. You only need a heart full of grace and a soul that's generated by love, and you can be that servant." Always remember the importance of the work that you do each and every day to build a stronger society and healthy kids. And always remember that you are great because you serve. Thank you very much.